MSD Episode 3. Today's episode, Combating COVID. I'm your guest host, Tyler Bennett. Joining us today is the School Health Coordinator and COVID Point of Contact, Nurse Kelly Fogleman. Ms. Fogleman, it is great to have you here today.
Thank you, Tyler. Glad to be here.
All right. So our first question for today, masks and screening. First question, what ages of students are required to wear masks?
We are going to require all of our students in grades K through 12 to wear a face mask or face covering this year while at school. The mask should cover their mouth and nose. We aren't restricting the material that it can be made of, but we do recommend that it be at least 2-ply to be the most protective. Mr. Edmonds spoke about neck gaiters last week. We are not limiting those at this time, but again, the preferred material is a cotton, at least 2-ply cloth mask.
One parent writes in, my child doesn't like wearing a mask. How do I teach him to keep it on?
I would recommend start working with your child now. Practice with your child wearing that mask, whether it's 30 minutes here and there, an hour, increase it as the days progress to the start of school. Involve your child in picking out their mask, make it fun, let them choose the color or the material. For young children, you could practice putting them, put the mask on their favorite doll or their favorite stuffed animal. Use positive reinforcements and praise, and also model the behavior of yourself and your family in your home wearing masks, and explain to them why we are wearing masks, that you wearing a mask protects others, and when others wear their mask, that protects you. So if kids understand the why behind it, they're more likely to buy into that guidance.
I also understand the school will be providing masks as well. When will the school be providing those masks?
Yes. Each student will receive one cloth mask on the first day of school. On that first day of school, of course, they may have a bus ride or a car ride to get there, so we recommend they wear their own face mask prior to coming on campus, and then they will receive their mask. Their masks will look like this for our older students. And then we have pediatric, maybe for our kindergarten, first, second, maybe even third graders, our Patriot logo masks.
How often should the masks be cleaned?
A cloth mask should be cleaned at least daily. And I strongly recommend to parents to send a backup mask each day with your student. When a student coughs or sneezes, ideally they want to leave that mask on to contain those respiratory droplets, so their mask may become wet or soiled. So having a backup in your child's backpack with their name labeled on it, even details like which side is the front, which side's the back, is helpful for the younger population.
What kind of daily screenings will there be for teachers and students?
We have currently implemented a screening tool for our employees. It's in progress now. It's a symptom-based strategy. Each employee is asked daily if they have a fever or a new worsening cough, shortness of breath, all these symptoms of COVID. And if they do have one of those higher risk symptoms or two of the lower risk symptoms, such as sore throat, aches, body aches, nausea, they are asked to stay home and contact their healthcare provider and possibly consider COVID-19 testing. That same system will be implemented for our students. We are really going to depend on our parents to be good partners with us this year. We will rely heavily on them to conduct a health screening with their child prior to coming to school. Make it part of your daily routine, just like, making sure your child is fed and they've had their medicine or they have the supplies they need, they have their face mask. Also do this health screening and keep your child home if they have any symptom on the list. We're going to be practicing in an abundance of caution to stay home when you're ill.
Going right into our next line of questioning, these are questions that have been submitted about if the kid potentially is sick. Our first question, what if a child is sick and shows symptoms in the classroom? What actions will be taken then?
Okay. If a child develops a sickness while at school, they will be sent to the school nurse. The school nurse has the skills to evaluate that student and determine if they have a COVID-like illness. If they do have a symptom or multiple symptoms of something we suspect might be COVID, they will be placed in a waiting room, like a sick room, a separate space from well students that may be visiting the nurse's office, and wait there until a parent can come pick them up. This is where we are, again, relying on our parent partners to pick your child up in a timely manner when you receive a phone call from the school nurse. Ideally, we would like that child picked up within an hour. And we also, I can't stress enough how important it is that the school nurse and the administration at your child's campus has the proper contact numbers to reach you, and even backup numbers in case you're not available or you work in a factory where you're not allowed to have your cell phone. Make sure we have good contact information to reach a parent of a sick child.
This was another question that has been submitted in. If a student in my child's class tests positive for COVID, will the testing agency be mandated to notify the school, or are we relying on parents to notify the school?
The facility that your child received the testing from is required to report all positive cases to the Arkansas Department of Health. The health department will then notify your child's school of that positive result. I would like to stress that that may not always occur in a timely manner or as fast as we would like. So we ask that if you receive a positive result on your child, to notify the school immediately so we can get that ball rolling. Contact trace who has been around your child so we can quarantine or isolate the others that they've potentially exposed.
Another question submitted: if my child is COVID positive, who all should be notified? Is just the teacher enough?
I would recommend, if your child tests positive for COVID-19, that you reach out to me and notify me immediately. I am the district point of contact for COVID-related issues and report directly to the health department. So the earlier you can notify me, we can get that process started. I can be reached at msd3.covid19@gmail.com or at 901-401-0265.
If a student is COVID positive, how long do they have to stay at home before returning to school?
If a student tests positive for COVID-19, they will be contacted by the Department of Health and issued a Department of Health nurse to follow their case. So ultimately, it will be up to that nurse and the health department to monitor the student and release them back to normal activity. I will say most cases of COVID-19 that just have a mild to moderate illness can complete a minimum of 10 days of isolation and then be released to their normal activity.
Now, what would the difference be between quarantine and isolation?
Okay, quarantine is for people that are not COVID-19 positive, but they have been exposed to a positive case, and they will be asked to quarantine themselves for a minimum of 14 days to watch for symptoms that may be developed or consider getting COVID-19 testing themselves. And isolation is for people that have been diagnosed and tested positive for COVID-19, and they must isolate themselves for a minimum of 10 days before they resume their normal activity. And to be released from isolation, again, has to occur from the health department. You get a release letter from them. You need to have improved symptoms and no fever for 24 hours with no medications prior to being released from the health department. And one more thing about quarantine and isolation is if either of those apply to you in your situation, that means that you need to stay in your home and not go to the grocery store and hang out with friends or have visitors over to your house. You really need to quarantine yourself from others, isolate yourself in your home. And if you are COVID-19 positive and you're isolating, and you live with other people in your home, isolate yourself to your own bedroom or bathroom if that's available in your household.
Last question about a sick child. If a child becomes ill from something other than COVID, what are the steps they need to take?
Okay, just like we do every single year, we will treat those like we always have. If that occurs at school, the child gets sick, they will still be sent to the school nurse. She will evaluate them, determine if they have an illness that requires being sent home, or follow up with their healthcare provider.
Our next line of questioning is about medications. First question, my child takes medicine. How do I get them to the nurse at his or her school?
Okay, great question. We know that there will be students that will receive daily medications at school. Because we are limiting visitors due to COVID-19, we are asking that if your child needs medication at school, that you make an appointment with your campus school nurse prior to school starting to drop that medication off to her and sign the necessary paperwork that's needed for your child to receive that medicine at school.
Say a child has an asthma attack at school. Will a nebulizer treatment be allowed?
Okay, great question. Nebulizer treatment is a breathing treatment that requires a mask be placed, and it creates aerosols into the air. So we are trying to limit the exposure to the nurse and to other people that come into the nurse's office by not generating any aerosols, doing any procedures that generate those. We're asking parents who have a child with asthma to talk to their physician and consider the use of a multi-dose inhaler with a spacer instead of a nebulizer treatment at school.
Okay. Regarding immunizations, do the students that are taking virtual learning need to have the same immunizations as the one with face-to-face learning?
Yes, Tyler, they do. All students in grades K through 12, regardless if they're learning virtually or face-to-face, need to be compliant with Arkansas immunization requirements. Our nurses have been working the last week or so, sending out letters for those that are not in compliance and are missing immunizations. So you should receive a letter stating what vaccine your child is missing and when that date is due that they need the vaccine, which is usually October 1st.
So that concludes all the submitted questions. Is there anything you'd like to add?
Yes, Tyler, I would just like to take this time to express that I know many parents and students are anxious and concerned about how this year will go. And I just want to reassure you that we will do everything in our power to keep your child and our teachers as safe as possible. We've been working really hard, the nurses, the teachers, the administration, custodians, every facet of this school district to plan to bring your child back and make it as safe as possible. I would like to remind that things are changing daily, and as new guidance is put out from the health department or the Department of Ed, that we will update our protocols and our policies and communicate that to our parents. But as a parent myself of a student that attends this district, I have many nieces and nephews that attend here. I want to make this as safe as an environment as possible to make it through this school year. I'd also like to add that we are still praying for Dr. Fenner and his recovery and can't wait to get him back soon as he leads us to the opening of school August 24th.
All right. Well, thank you very much for joining us, Ms. Fogleman.
Thank you.
And thank you for joining us for episode 3 of You, Me, and MSD. Join us next time. Go Pats.